Hi, Jessica. My name is Cade. I'm with the athletic training department.
I
Um, so, just a little kind of background on the whole telemedicine thing. Um, I am in a secure room. No one's going to be coming in or out. So, the information that you tell us will stay between us. Nobody from outside is going to hear it. Are you in a secure location where you're comfortable sharing information?
Yes.
Okay. Um, And then I see you signed your consent form to tell us information and everything. And then if there's any like Wi-Fi issues or computer malfunctions or something like that, then you can always call us back on this link and then we can get in touch through Zoom. Do you have any questions for me so far?
I don't think so now.
Okay. All right. So tell me a little bit about what's going on.
So I was playing with my friends. We're playing football. I'm on the football team as well, and we were just practicing in the park. We didn't have our equipment. We left them in the locker, and as we were playing, I ended up getting tackled. It was harder than normal, I guess you would say, and I honestly don't remember much from that incident, and like my nose is like really hurting right now and I don't know what's up.
Okay. Have you ever hurt your nose before or anything like that?
No.
Okay. Did it bleed when you got tackled or anything?
At first, no, but I think it took like about a couple of little bit, then it started, I guess, is what you could say.
Okay. So you had that, the like you got tackled initially, and
Mhm.
then a couple, I guess, seconds later, then it started to bleed, or
Yes, I believe so. It was like I honestly don't remember much from that day.
okay. Um, so I'm assuming that you've looked in the mirror before, correct? Since
Yes.
this has happened.
Yes.
Do you notice any like deformities? Like, is your nose crooked at all? Is it still straight, or
It's it's not straight, I can tell you that.
it's not straight?
Yeah.
Okay. And then when this initially happened, what would you rate it on a scale of 1 to 10? Like one being like just a little bit of pain, and then 10 being like take me to the hospital.
I would say around 6, 7.
6 or 7? Okay. Um, and then how does that compare to right now?
Um if I stay still, like it's like around that, like around a 5. But like if I start moving, like it that increases.
Okay. Have you been doing anything for your nose? Like, have you been taking any like pain medications or anything like that?
Uh, I believe so. Yes.
Okay. Do you remember what you were taking?
I think it was Tylenol. It was one.
Tylenol? Okay. Um, are you having any other like head issues, like headache, dizziness, any nausea, sensitivity to light, sensitivity to sound, anything like that?
Um, I would say light.
The light bothers you? Okay. How is it sitting in front of the computer screen? Does the light from the computer screen bother you?
No, not really.
Okay. And then, are you a TOU student?
Yes.
Okay. Have you gone to class since this has happened?
In person, no.
Okay. Um, so I'm, I'm assuming you're going to class on Zoom then, correct?
Correct.
How are classes going on Zoom? Like, does it get to a point where you start to have like a headache or anything like that, or like mental fatigue?
Mm, I think it's going well. That sometimes, like, it depends on like it's been a while since the accident happened, and um I've notified my teacher saying that, oh, I don't feel good, and sometimes I would have to leave early. But I would notify them at least.
Okay. Um, how long ago did this happen?
It was a couple of days ago, I think.
A couple of days ago? Okay. And it's kind of stayed that constant pain, or does it come and go?
It comes and goes, but it's like a long period of time when it comes.
Are you having any difficulty breathing or anything like that?
Sometimes when I lay down, yes.
When you lay down? What position are you laying down in? What makes it difficult? Is it on your back, side, on your stomach?
Um, More when I do it to my side, it's difficulty to breathe. Like when I'm like, they're both bad. I can say that. It just it's worse when I'm on my side.
Okay. Is there a certain side that's worse than the other?
I would say my right.
So laying on your right side makes it a little bit more difficult to breathe than your left?
Hmm.
Okay. Um, has your nose, like, have you had any like drainage since this has happened? Like allergy type stuff, or has it started bleeding again or anything?
Yes, I've had a little bit of drainage. It does bleed sometimes when like I sneeze or something like that, and
Okay.
that really hurts. Yes.
Okay. Um, so when your nose does have that drainage, is it like clear? Does it have some blood in it? Is it like mucus, basically, like that green?
It's more, I think it's more blood, I would say.
More blood?
Yeah, because I don't see anything else.
Okay.
I don't see anything else in the tissue sometimes.
Okay. Um, nursing, do y'all have any questions?
You said there was no clear drainage or anything? No. I'm good.
So from the stuff that you've told me, I would say it's safe to say that you sustained a nose fracture. And so that would explain why your nose is not straight anymore. It explains all the nosebleeds, why it hurts when you sneeze, and that difficulty breathing, because basically when that um, the nose is not straight, it can obstruct the airways, and so that is what makes it hard to breathe. And then for treatment, I would go to the hospital or go see a doctor, just because they would have to realign it. I would not recommend trying to realign it yourself, because that can cause more harm than good.
Okay.
And then, did you have something to add?
Yeah, you had another kind of incident report, or there's something else in the patient folders. Are we allowed to look through that stuff too? Other than like the nose? Um, I guess my concern would be, do you feel safe going home?
Yeah. Yes.
Yeah. And were you living in dorms right now, or
At the moment, yes.
um, will you be going back home with your parents soon?
My daddy.
Um, do you feel safe going back home to your dad?
Yes, I do.
So basically, just kind of cover what I was going over. I would go see a doctor so they can uh, realign your nose. Again, do not try and realign it yourself. Basically, the nose being crooked is what is obstructing the airways and making it difficult to breathe, like when you're laying down on your side. And if you want, you can continue to take Tylenol. Do you notice any like swelling or inflammation through your nose and under your eyes?
More on like on my nose and then under this eye right here. It's just it started like it's swelled and it's going down like less and less. Like it's still kind of swollen, but like
Okay. Any vision problems at all?
no.
Okay. So if you would like, you are more than welcome to take like Aleve or ibuprofen. Those are basically anti-inflammatories, and so it'll help try and take away that swelling that you have. It'll also help with pain. So, um, do you have access to either ibuprofen or Aleve or Advil?
Yes.
Which one do you have?
Advil.
Advil? Okay, so Advil and ibuprofen are basically the same thing.
Mm-hmm.
Are they the 200 milligram tablets? Do you know?
Yes.
Okay. So basically, from our team physician, the prescription dose that he recommends is 800 milligrams per dose. And so that would be 4 of the pills, and you can take that up to 4 times a day. So basically, with breakfast, lunch, dinner, and then again before you go to bed, I understand that is a lot of pills. Like that's 16 per day, and I don't like you don't have to take all of those. If you normally take like 2 at a time and you feel like that does um, what it needs to do, then you're more than welcome to do that. But Advil has been known to cause some like stomach discomfort.
Mm-hmm.
And so if you do notice that, then we'll back off the dosing, whether it's how many pills you're taking or the number of times per day. We can kind of play with that a little bit and see which works best for you. And then along with the uh, nose fracture, it sounds like you also have a concussion from getting tackled. Um, Basically, like the sensitivity to the light, the mental fatigue that you experience, like going through class, um, the like the fact that you couldn't remember much about that day, kind of things like that, kind of line up with symptoms of a concussion.
Mm-hmm.
And so basically, what I can do is I'll get you a referral form to send you to the doctor for your nose. And then I will also notify all your professors and everything about what's going on, that you have sustained a concussion and that um, you can leave class early and stuff like that. But I know you said that you've already notified them, but it'll just reiterate basically so they know that you're not lying, because I know some professors have like they're skeptical about some people. Does that make sense?
Yes.
Do you have any questions for us?
No.
All right. Let's do a follow-up here in a couple weeks, see your progress and everything like that. And then if we need to have like a change in care plan or anything like that, then we can address that then. And then if you ever have questions in between that 2-week period, then you can always call us on this link. Does that make sense?
Yes.
All right. Well, I appreciate it.
Thank you.
All right. So now we'll do Peyton Parker.
Hi.
Hi, Peyton. How are you today?
Good. I don't really care for these online doctors, but my aunt made me come, so here I am.
Fair enough. It's not the easiest to do this stuff. So basically, like the whole telemedicine thing, I just want you to know that I am in a secure room, so nobody's going to be coming in or out. So the information that you are telling us will stay between us. And then you signed your consent form to give us the information. And then if you have any connection issues for Wi-Fi or your computer starts getting messed up or anything, you can always call us back on this link and be good to go. Sound good? Okay. So in my notes, it says that you are experiencing a fever and don't feel very well.
Yeah, I took my temperature today finally because it's been a couple days, and it was like 101, and I've been sweating a lot too, and I just feel like crap.
Okay. Is this like a normal thing for you? Like, do you get sick every year or often?
It depends. I guess every other year probably.
Every other year?
Yeah.
Okay. What do you usually get? Is it like severe seasonal allergies? Is it like flu based, cold based?
I get allergies pretty bad.
Allergies?
Yeah.
Is it a certain time of year that this happens? Is it year round? Is there a certain allergy or allergen that causes this to act up?
I need to go get tested still. I don't know which allergen specifically, but it always happens around fall.
In the fall?
And I don't know if this is anything, but this has been bugging me a lot lately, and it really hurts.
Okay. When did that pop up?
I noticed it like yesterday, and it looks pretty gnarly now, but it really started to itch, and so I itched it, and now it's like kind of rotting inside, it looks like. But I don't know if that has to do anything with it.
Okay. Did you get hit on your hand or anything, or did it just kind of like pop up overnight,
I
or?
don't know. It started at, it looked like a red spot, and then I started itching it. I don't know if it's a bite per se. Because I didn't notice anything, but then like a couple days later, it just got a little bigger, and then it started to like kind of like rot in the inside. So I don't know.
Okay. Did you notice like a white pus ball in there at all, or was it just red, or?
A little pus in the inside.
Okay. Does it cause you a lot of pain?
Yeah. Yeah, it hurts.
And then that like circle around the red area, has that gotten bigger over the past couple days?
Yeah. I should have, my aunt told me to like mark it with a marker, but I didn't, to see if it would get bigger, but I haven't. But I have noticed it has gotten bigger.
Okay. And then you don't remember getting bit by any insect, or there was like
I
mosquito,
don't know.
spider, or anything like that?
I didn't notice it at the time if I did.
Okay. Okay. So, is there any other spots like that on your hand, or
It's just that one.
just that one?
Yeah.
Okay. So did that pop up about the time you started experiencing the fever and not feeling well?
Oh shit. Yeah, I guess it did.
Okay. Has there been anything else that you're experiencing besides the fever, the itching, and the pain?
Uh, that's pretty much it for the overall body, but for the spot itself, it's just painful and itchy.
Just painful and
Yeah.
itchy? Okay. You didn't happen to go through any like poison ivy or poison oak or anything like that, did you?
No, but I was in my shed the other day.
You were
I
in
was
your bed?
in my shed. I was doing some stuff outside.
Okay. Do you remember cutting your hand at all or anything like that?
Not besides a little paper cut. That was it, though.
A little paper cut?
Yeah.
Where was your paper cut?
It was on like my finger, but so it's a little close, but it's not on the spot.
Okay. Um, so basically from like the signs and symptoms and stuff like that, it almost sounds like a staph infection. So basically, with staph infections, you do get that little red bump, and these can pop up pretty much anywhere on your body. But the itchiness, the fact that redness around that nodule got bigger, um, it almost looking like it was rotting inside, and then the pus inside of it, that all lines up with a staph infection. So basically, for treatment of this, we will refer you to the doctor, and I'll email you a referral form so that the university pays for it and nothing like it will come back to you. But basically, the doctor will assess it and everything, hopefully come up with the same diagnosis. And then if it is a staph infection, it's bacteria based. So he can prescribe some antibiotics. It can be treated with like penicillin, or if it's penicillin resistant, then they will assess it like with a different antibiotic. Are you allergic to any medications?
No, not that I know of.
Not that you know of? Okay. Um, Nursing, do y'all have anything?
Just if you got a chance to check your temperature at home, like, did you happen to get a reading of it?
I did. It was 101. I didn't like get a picture or anything with the thermometer, but yeah.
Okay, well, that's pretty high.
And I've been sweating too.
Did you have any like difficulty swallowing at all?
No, nothing like that.
I think that's all I have. Thank you.
So did you put any cream on your hand?
No, I put a Band-Aid over it. Like yesterday, I took it off to show y'all, but I did have a Band-Aid, but I didn't like put any ointments or cream or anything on it.
Was it have a lot of dryness or it's dry?
It's pretty dry right now.
Do you have more Band-Aids or other supplies that you can continue to cover that with?
Yeah.
Okay. That is very important for staph infections because they are contagious. So yeah, really make sure that you're covering it, keeping it clean. If you want to put like the triple antibiotic ointment or like Neosporin or anything like that to kind of keep it clean, I would highly recommend that. I would stay away from hydrogen peroxide and alcohol just because when you pour that on there, that will kill all of the bacteria, yes, but it'll also kill all of the good cells that are trying to help it heal at the same time.
Okay.
So I would recommend sticking with the antibiotic ointment.
Okay.
Does that make sense?
Yep.
Do you have some of that at your house?
Yes, we do.
Okay.
A whole medicine cabinet full of random crap.
Sweet. Do you have any questions for us so far?
I guess that's it.
Okay. So I would like to do like a short little follow-up here in a couple weeks to kind of see how this is like progressed. See if like the antibiotics are working, if you need to go back because they're not, if pain has gone down or anything like that. For the pain, you can take some anti-inflammatory medications like Aleve, ibuprofen, or Advil. Do you have any of those at your house?
Yep.
Which one do you have?
I have a leave.
Aleve? Okay. So basically, the team physician that we work through, his prescription dose for Aleve is 2 pills in the morning and then 2 pills at night. This has been known to cause some stomach discomfort. So if it does start to cause that, then we will either do 1 pill in the morning, 1 pill at night, or we can try 2 pills in the morning and nothing at night, or 2 in the night and nothing in the morning. So we have some different variations that we can play with to see which one treats you the best or you feel like works the best for you. And that'll also help with pain and the swelling going on.
Cool. Thank you.
Mm-hmm. And then I would, again, make sure to keep that covered and everything and try to avoid scratching it anymore, just because it could make it worse. Does that make sense?
Yep.
Okay. Nursing, do y'all have anything else? All right. Well, we will see you in a couple weeks then. Bye.